in the heart of Yorkshire. Our health service is hard at work.
Barnsley Amy, just waiting for that bed to be ready.
Your double room, your sea view.
A dedicated team working around the clock in Casualty.
Will somebody do me the next transfer, please?
Thank you, loveliness. Anything else hurting?
Yeah, my feelings.
Nice to meet you, sweetheart. He's all tapped up for you. Ask somebody else.
They're with us for our most vulnerable moments.
There you go.
You're being braver than your mum.
That tastes nice.
No, oh, bless you.
Facing life and death.
You either want to live or you don't.
Trauma and tears.
I think there's quite a chance you've broken your hip.
Supporting each other through the toughest shifts.
You're my favourite.
This is Barnsley Casualty 24/7.
Gonna send you home.
You're far too cheerful to be an A&E.
Somebody will realise me.
I love you.
On shift tonight, Advanced Nurse Practitioner Richard Jackson.
Can you stick your tongue out for me? That's really dry, isn't it?
Volunteer Jane Allen.
Find all sorts under trolleys.
Junior Dr George Kay.
And am I right just to have a quick feed of your tummy?
Oh no, I really don't.
No. Okay.
And Clinical Nurse Manager Val Parkin.
Can't find patients, can't find nerds, can't find doctors. Can find nurses though.
So get ready to share a shift at Barnsley Casualty. As temperatures drop, Barnsley Casualty has seen its patient numbers rise.
Alrighty.
And after a record-breaking few days, the department is struggling to get back on track.
I can see that you're slammed. Has anyone got a patient that could come out of the cubicle? Any takers?
So all them that's been here extensive amounts of time have all eaten and all drank, and the relatives.
Other departments are full and corridors are clogging up with patients. The wait to see a doctor has already reached 5 hours. Nurse Val is the manager in charge of Casualty today.
I am the boss, I guess. But if I had to choose shop floor or office, it would be shop floor every time.
So, how are we doing?
We're at 31's been 10 hours 31.
With the department struggling, Nurse Manager Val has cancelled her meetings and is in the hub to lead the team.
I've only worked in Barnsley a year, so the team don't know me, I guess, as well as some of the others. But I'd like them to know that if they need me, I'm there.
Nurse and staff make each interaction count. When you're in a room, even if it's to just do something, do a set of obs so that we're always ahead rather than trying to play catch up. Come to me and tell me what you want. Let me be your protocol.
Yep, sounds good.
Thank you.
It's crucial that the department starts to run efficiently.
Can I speak to the nurse in charge, please? The agreement was that you were going to come and collect these patients for us.
And that means being firm about what's needed to reduce the backlog.
We're hammered down here, so if you could take both of them for us, that'd be really, really good. Fab, thank you very much. Bye.
Paramedics are bringing in a 63-year-old man who's had an accident at work. Lorry driver Steve's leg has been crushed by a forklift truck.
Right, we'll try to sit you up a bit, alright?
Yeah.
You might not be too comfortable for a minute. Right, Steve, just nice and steady, don't have to be too fast.
I can't be too fast.
Right, put that leg on bed and push down with that leg. Push it one more bit. Right.
Ah, that'll do.
Right.
Oh, that's painful now.
Tap. Try flatten it out now.
I better miss breakfast, haven't I?
I think you're right. Steve, there you go, you can rest that leg down straight now.
Steve was waiting for his vehicle to be loaded 8 miles outside of Barnsley when the accident happened.
You work in Barnsley then?
No, I work in Sheffield.
Alright, I wondered why you come to us.
Well, no, I didn't want to, because hospital's only 400 yards from our house.
Normally they can deal with break by putting a cast on.
Right.
Do they send you home same day?
Well, I don't know.
I was going to go out for my birthday next week, but I doubt we'll manage that.
All right.
Okay, Flower.
All right, take it easy.
Cheers, Pet.
You're welcome.
See you later.
See ya.
Bye-bye.
While patient Steve waits for a doctor to assess his injuries, nurse manager Val is working at being patient.
Right, now me and you need to have a conversation about you getting off the bed every 5 minutes, because I'll be really honest with you, I haven't got the nurses to keep coming and putting you into bed. Up you go. I don't want to get bossy, but I will.
I still get the same feeling that I did when I first walked out on the shop floor. I thought, oh my God, what have I come to? Because it was just chaos. But over the years, I've learned to love that chaos.
Where's your pain? Don't laugh at me. You beggar. Do you know why he's done that? Because he knows in 5 minutes' time I'll be back in there, picking him up off the floor, putting him back in bed. It reminds me of 2 kids I have at home.
Consultant Dr. Joe Stone has arrived to assess Steve.
Has Danny been hit by a forklift truck
Yes.
at work? How did that happen?
He run into me from back, I didn't hear him.
Okay, fine.
And I didn't see him, and he got my foot trapped between pallet and floor. And then when I see my ankle spinning round, I knew it was broke.
Are you wanting anything else for the
Yeah.
pain, or are you all
Cup
right?
of tea, love.
A cup of tea. All right, just going to loosen the straps.
Okay.
All right, is your knees raised? Is that where you've fallen to the floor?
That's where he knocked me forward.
All right, you tell me if anywhere's
Oh, I will,
tender.
don't worry. Right, I'd slow down a bit.
Okay.
That one.
There's that one there. Okay, fine. Okay.
Ah!
Barnsley Casualty is struggling to clear the backlog of patients after an extremely busy few days.
We need more fluid, Pat, don't we?
Nurse manager Val has left her office to help her team. She has to get the department back on track.
I think we're going to hit 100 today. We haven't even really seen an influx yet. I know we have, but do you know what I mean? We haven't had our usual. Just hot enough intake.
When I was 5, I got badly burned and I spent 3 months in hospital. I watched nurses that were just completely inspirational because they were just so lovely to me. They allowed me to look after other kids, even though I wasn't particularly looking after them. I'm sure it was a bit more of a hindrance than a help to them, but it was beautiful, and I knew from a very young age I wanted to be a nurse and a mum, and I'm thankful to say I've done both.
You feel your pulse. Have we checked your blood sugar since you've been here?
I don't know, to be honest. He's taken...
Did they prick your finger?
No.
Okay, I'm going to prick your finger. I'm really sorry.
Despite nurse manager Val's assistance, the department is still struggling to cope. Space to treat patients is in high demand. Lorry driver Steve has been hit by a forklift truck. He's waiting to hear what damage has been done. He's hoping he can get back home to Sheffield soon.
Yeah, so it's done a fibula at the top and then tibia. And it's slightly off-ended as well.
Junior doctor Anna Taylor has his X-ray results.
It's not
I've
that
not
old.
seen a break that clean before. Nasty.
Yeah. The X-ray shows that you have actually broken both the bones in your leg.
It's both.
It is both, yeah. So it's going to need an operation to fix. So the orthopaedic team will come and see you.
Yeah.
And I think they said they've got a slot in theatre tomorrow morning. So we'll let you eat and drink for now, and then they'll come and discuss with you exactly what they're going to do in order to mend the fracture.
Steve won't be going home today, but with Sheffield Hospital right on his doorstep, he does have a plan B.
Is is there any chance of getting transferred to Sheffield then?
That would depend on the orthopaedic team. So I think the.
Are they open to bribes?
I'm hoping not.
After operation, I'll get a taxi back. No, so it doesn't bother me. I don't need an ambulance. I can manage.
Yeah.
As long as I get.
As long as you get to Sheffield, that's your main worry.
Yeah.
I'm sure they will see what they can do, but yeah, it's going to be out of my hands. All right.
Okay. Cheers then.
All right.
Thank you.
With the orthopaedic department as busy as Casualty, Steve will have to wait to find out whether his transfer wish will be granted.
Alright, I'm going to Peds.
On shift today in Casualty's paediatric unit is junior doctor Jake Mullen.
Alright, so what's been going on?
6-year-old Ollie has been brought in by his parents, Kirsty and Kyle.
He started with pain in his back on Saturday night, and then he's just got worse ever since, and then this temperature started on Sunday night. So he's been sleepy, he's just been warm, he's been sick a couple of times, but I think it's because of temperature. We went to doctors, he checked him over, said it were not an infection that he can see, he thought it were an infection of his spine.
Yeah.
So that's why he set us up.
I think that's the worry, anyway. I don't think we think it necessarily definitely is.
A spinal infection, or discitis, is a serious condition and can need surgery.
He's complaining of back pain. Where about in his back?
Where's your back, darling, Nathan?
On the bottom. Is it painful now? Is it all the time? Okay. Do you think it's really bad or quite bad or, you know, okay? What do you think right now? Really bad? Okay. Okay, Ollie, tell me when it starts hurting, okay?
You listening, Ollie?
Alright, try and touch your toes.
If Ollie does have discitis, bending over will cause him pain.
Hey, that's good.
With Ollie able to touch his toes, it's possible his symptoms are caused by something else.
Diagnosing children can be really hard because often they can't tell you what's wrong and you have to try and figure it out yourself. You have to read the signs, read the way they're reacting to you and try and figure it out from there.
Do you know what sort of temperature he's had?
In and around 40.
Pretty high, really.
It was very hot last night.
Has he had any pain relief?
He's had it 4 hourly, Nurofen and paracetamol, and it's just doing nothing.
Okay.
We get quite worried if they've got a temperature that's not settling. They can go from being poorly to seriously ill really quickly.
I need to examine you, buddy. Tell you what, I'll go get some sheets and we'll get you on the bed and we'll have a listen to your chest and all that sort of stuff. Is that okay? All right, so I'm right back. No, I don't have any balls, but this will do for now. Ollie, really sick. Oh, I'm sorry.
Tough start. No.
You're feeling sick, you start gagging. Oh, poor kid.
Go on, you sure?
I think I'm going to examine you with gloves. How's your tummy? Does it hurt when I'm pushing you? You want to sit up for me and I'll have a look in your mouth? Oh, come on, open your mouth, mate.
Mate, come on, he needs to look in. Come on.
Yeah, right.
Open your mouth, look.
He looks really miserable, doesn't he?
I don't like Steve.
I know you don't like Steve. Take your tongue out.
Yeah, well done, that's great. I'll get a urine sample.
Yeah.
And we have to have a chat with my boss, see what they think.
Yeah, that's
okay.
With Ollie's temperature remaining dangerously high, a diagnosis needs to be made soon. In the hub, volunteer Jane is feeling the heat.
I said, does it any come out? What side does it come out?
Don't put your face in it, Jane.
Why? Yeah, but it's not blowing on me. My mother's coming in this morning.
Not poorly.
Oh gosh, no. She's come to have her hearing aid because you know when you tried to fix it once before and
Yes.
you did an absolutely terrible job.
Well, in my defence, I'm not a hearing aid technician and it was very complicated.
It was
You
complicated.
have to go to a specialist.
Yes. Well, now she needs a new hearing aid in
Right.
piece.
Well, I might be able to fix that one if it's...
I doubt it. You couldn't fix it when it were a battery. should be coming in this
All
morning.
right.
So I just thought I'd let you know, darling. So in case, you know.
Say hi from me.
Well, if you say she'll be able to hear you when she's had a new hearing aid.
Six-year-old Ollie has a high temperature and backache.
Can I have a chat with you about it?
Dr. Mullen hasn't been able to confirm a diagnosis, so he discusses the case with consultant Dr. James Griffiths.
Ollie, he's a 6-year-old. For the past 3 days, he has had a temperature and lower back pain. GP was worried about discitis. I'm getting a urine sample.
Bend over and touch toes.
Yeah. I mean, yeah, he can bend over, touch toes. He doesn't seem particularly tender on his lower back.
Discuss with peds.
Nurse manager Val understands how worrying the uncertainty can be for parents.
My daughter got very ill last year, and that was a really, really difficult time. There was a period of a week where nobody really knew what was wrong. Now I know that they genuinely didn't know, but at the time you've got this like paranoia going on in your head thinking, well, do you know, and you just want to tell me. What it kind of did was give me an insight into how it feels to be a parent of a sick child.
The reason the GP referred Ollie in was because he was concerned about something called discitis, which, like you said, is basically an infection of the spine. He does have a temperature, a good going temperature, and he looks really miserable. I'm not entirely sure why. I can't sort of really pinpoint exactly what's causing it.
This temperature is really worrying when medication's not doing anything. It's scary.
I think the most important thing is that we rule out there's any localised infection, especially in the spine.
When you have worried parents, the best thing we can do is just communicate with them really openly and honestly and make sure that they're fully aware of what's going on.
Ollie is transferred to the paediatric ward for further assessment.
Come on, sausage.
Yeah.
Ain't got much.
Where he was diagnosed with an upper respiratory tract infection, a common virus affecting the sinus and throat.
Thank you.
After spending the night in the hospital and a few days off school, he's now back to his normal, lively self.
This box is for clean clothes for anyone who needs them. It is not lost property.
Back in the hub, Jane is eagerly awaiting the arrival of a VIP, a very important patient.
I'm here, Jane.
Her mother, Mary.
To have 2 new hearing aids.
2?
2, yeah.
Is one not enough?
Well, I've got to have 2, so
All right.
I'm very pleased.
Oh, very pleased indeed.
And the young lady was lovely.
Was she?
Yeah.
Oh, good.
Good morning. See you later.
So, but you'll have to come to have it fitted, won't you?
Yeah.
Bye, Mother.
Ta-ra, see you later.
Yes. Walk a bit faster, love.
Did somebody shout Mary?
Oh, God, Bennett.
How far away are you guys? About 5-10 minutes. Okay.
Paramedics are on their way with a patient struggling to breathe.
Bring him into the recess, we'll see him there. Thanks very much. Cheers. Bye.
Nurse Richard prepares for the arrival in Resus Bay 1. 63-year-old Keith is in the advanced stages of motor neuron disease, a condition that gradually stops messages from the brain reaching the muscles.
Hello there, you all right? Is this Keith, we said? Yeah. And how do you know Keith? You're his wife, your boss.
Keith's wife, Tracy, is concerned that he's less responsive than usual.
All right, Keith, we're just going to go onto this other trolley. Ready, steady, slide. And then we'll get you sat up again.
Motor neuron disease can affect the patient's ability to walk, talk, eat, drink and breathe.
Hello there, Keith. My name's Richard. I want to advance on as practitioners, and I've already met your wife, OK? So what's been happening then?
I did go to work at morning because my sister-in-law and my daughter were coming.
Yeah.
And he didn't even know the thing.
Right, so he's been confused.
I think he was just out of it. So
Okay. Has he been chesty at all and difficulty breathing? No. So this breathing pattern's normal for him? And what about eating and drinking and taking on fluid?
today,
Yeah.
he hasn't eaten anything.
Okay, Keith, sorry about that, so I'm just going to have a look in your mouth. Can you stick your tongue out for me? That's really dry, isn't it?
I think the machine does that.
So he's on non-invasive ventilation.
When he comes off that, he has to have a drink or wet his mouth.
Do you think he's aware of what you're saying to him at the moment, then?
Yeah. And I think he has been getting confused and hallucinating because I can't understand what he's saying. It weren't making sense.
The life expectancy for Keith's form of motor neuron disease is 2 to 5 years.
When were he diagnosed then?
It'll be 2 years this February.
Yeah.
Keith's daughter Amy has arrived. When staff are faced with chronic and devastating illnesses, honouring the patient's and family's wishes becomes as important as the medical care.
I want to help people, I want to make sure people are pain-free, they know what's happening and that they're being looked after, and that's all that we can ever ask for. I suppose I'm just trying to think about what I want to put him through today in terms of how far you want me to go now, at this minute, and what do you want me to do? Because he's not ventilating very well at all, and I just wondered if I need to do something about that. And then we have to think if that doesn't work, then we're talking about intensive care, but I don't think he's a candidate for intensive care.
For Nurse Richard, part of his job is being able to raise difficult questions.
Have you had chats about end of life, how you want to do things, and where did Keith want to die, did he say, or?
No.
So I want to try and get this blood test now. We'll see how all this blood test is and see where we go from here. I think if the breathing blood tests are really, really bad, I might not be able to improve things.
No.
And it might be that we don't do anything, but make sure he's comfortable.
Yeah, that's what we'd want.
Start scratch, Keith. I'll be 2 minutes while I get this sample second, and I'll come back and have a chat with you both, OK?
The blood test will reveal how much oxygen Keith is getting into his lungs and what Nurse Richard can do to help him. Val and her team are working flat out to get to all the patients.
It was awful at the beginning. Winter is here.
Cubicles are full and patients are having to wait in the corridors, including Steve, who's been coping well with the pain from his broken leg. Until now. Barnsley Casualty has had a run of busy days, and nurse manager Val is trying to restore order.
Oh, it's so annoying when you can't find anybody's notes. Again.
Just when you can't find patients.
So there's a little bit of a theme, isn't there? We can't find patients, can't find notes, can't find doctors. Can find nurses though, so that's good. To an untrained eye or to somebody that's just come, it does look a bit frightening. It does look very chaotic. Sometimes it has, the sounds and smells of a zoo, but there is an order to it. You just have to look really deeply to find it. I'm shouting.
Tram! Broken leg!
Let me just find. I'm shouting and I'll be back to you in 2 minutes. Where did that come from?
After an accident at work, lorry driver Steve has badly broken his leg.
This strap's just a bit tight. I'm going to get you some pain relief now and we'll get you nice and comfy, OK? You feel me touching your foot?
Yeah, I can feel that.
Can you feel that?
Yeah,
and underneath?
It's right up like a leg muscle.
I know, it's because your leg's been still for this long, but what we need to do, we need to put you in a pot.
Jeez.
To ease in.
Lying still for so long has caused Steve's leg to cramp. Once it's in a pot or plaster cast, it should ease his pain.
Jesus. Yeah,
I'm just going to massage the back of your quad. All right, okay, and that will ease, I promise. Just take some nice deep breaths.
What's the matter if you've got other leg?
Sod's law, mate. So, been delivering babies on this for years. So, take some big, nice deep breaths. Are we waiting for you? Okay. Breathe for me. Come on. Good man. Hold it. Let it go. And again. You got Big breath. Good man. And relax. That's it. I'm going to get you some really strong painkiller now. It's going to make you feel like you've had some gin. Put your head back to me. Have you been looking after him? Can I have some morphine for him? He's had some cocodamol and that's about it. But he's going to get pots on. So a lot of his pain is probably going to go once he's in pot.
Yeah.
But if we could just have something.
Yep.
I think Zoe's gone to find his notes. Good man. I'm just waiting for my morphine. Well, not my morphine. His morphine.
Freaking hope it's mine.
I think I might get into a little bit of trouble if I have that at work. This is the good stuff. Right, so this is going to make you feel a little bit woozy.
Yeah.
You've had a gin and tonic, or 2, or 3.
5. 8.
Just keep that foot relaxed.
I'm trying.
I know.
I'm trying.
Were you in the army?
I went Paris and we used to give morphine when a lad broke his leg and we were more than 3 hours from hospital. But they were them little pipette things, snapped up, banged it in his leg and that was it for him.
Did it open?
Yeah, we did when somebody else went up and gave him another one. Because you're supposed to write M, aren't you?
Yes.
On the forehead.
Yeah.
We all forgot. He was eyes kite when he got off.
Is that any easier or is it the same?
Feels okay for now.
I'll be back, don't worry. I will know where you are and I will find you. Okay?
I will let you know.
Alright.
Volunteer Jane doesn't just keep the patients of Barnsley fed and watered.
Lost property is another bane of my life. I always seem to be the one that goes through it. You know, to get my gloves on, have a go through it. These are all wet through. Well, these are all absolutely wet through. People come in and they'll leave the clothes and then they haven't got nowhere to go home in. How people can forget that they've got the shoes, they've left the shoes and their house keys and the phone, I don't know, but unfortunately they do. And they never come back for them. Anna, you just observe. There's money in it. Jason says name, but there were no name up there. Has he gone to... Right, I'll ask her. Right, so we've found a clothes with a wallet and some money.
It's time for Volunteer Jane to turn detective.
Can you read there? That's all I've got, so I don't know. Yes, see if he's still here by any chance or whatever. Trying to reunite people with the lost property can be a challenge sometimes, and I feel a little bit like Columbo. Right, he's on ward 33, so I'm going to go up now and take this up for him.
Case closed. But, in the words of Columbo, there's just one more thing.
We'll find all sorts under trolleys.
Lorry driver Steve has broken his leg in 2 places.
This all-inclusive band. Come on, I don't know what I'm having. I shouldn't laugh, should I really?
Junior Dr. Nick Sinanen from the orthopaedic team has arrived to discuss Steve's injuries.
I know you've already told these guys here, but do you mind telling me how it happened?
As I'm walking across to my wagon,
yeah,
he's come straight behind me with fork truck, so he didn't even see me until they started screaming at him to stop. And that's when he was running over me.
Okay. So did he hit you from behind?
Yes, he hit me from behind.
Steve needs an operation, and he's keen for it to happen closer to home, at Sheffield Hospital.
The plan is we'll get another x-ray just to make sure the fracture hasn't moved at all.
Yeah.
We'll take you up to the ward, sort out all the things for you pre-theatre, and then the consultant's just got to speak to the Sheffield consultant, and hopefully that should happen. So we will try and get you across to
So that'll be
Sheffield.
after surgery?
No, before surgery. If we can't, it'll have to be to stay here for the op.
So from having operation, how long then will I be in?
I would say at least a day or two. It just depends how people recover.
Not a full week then?
All being well. It's hard to put a timeline on these things and how people recover.
As soon as I can walk with a crutch, they normally say, don't they?
Yeah, but don't quote me on that. All right.
Okay, no problem.
Right, I'll
Cheers
see you
then.
upstairs.
Thank you.
All right, see you later, mate.
Steve didn't make it to Sheffield Hospital. The waiting list for an operation was 5 days. So he had his surgery at Barnsley the next day and is now back home in Sheffield. In Rhesus Bay 1, 63-year-old Keith is in the advanced stages of motor neuron disease. With him are his wife Tracy and daughter Amy.
This initial blood test is not very good, I'm afraid. I think he's heading towards end of life now. And I think me being really aggressive and putting an IV on and in intensive care is just probably not fair. So my plan would be to keep him comfortable and maybe, if able, to get him home in time to die at home where he wants to die. I just think if I'm really aggressive, I still don't think I'll win. No, he don't want it, no.
Nurse Richard will discuss Keith's case with a more senior doctor before deciding on a care plan.
Oh, sorry, Dad.
Back in the hub, nurse manager Val is still battling to get patients treated and the waiting times down.
I'm just with the patient. I'll be with you as soon as I can. Oh, you're afraid you might lose your chair. Possibility.
Patients are still waiting over 2 hours to see a doctor.
If in the meantime you need anything, I'm going to give you a buzzer. We might not come immediately, but we will definitely come. Thank you very much.
The team are working hard to push the waiting time down even further.
They are. I need to find where she is, though.
Dr. K is on his way to treat his next patient.
I'm just going to find us a free room, but I'll be with you shortly, okay? Sorry to interrupt. Has anyone got anyone in the cubicle that come out? 7. Thank you.
Following a fall at home, 92-year-old Phyllis
Thank you.
has been brought in by her daughter Susan and granddaughter Jenny.
There we are. Sorry about the wait. It's getting a bit manic here today, isn't it? Oh, right. So, what's happened to bring you to hospital today?
I've had a fall or two. I sat on the bed and slipped off.
And did you hurt anywhere at all?
No.
No. And how are you feeling at the moment?
Fed up.
What, because you're here?
Yes.
Yeah. I think when you're dealing with patients of the older generation, they can quite often be quite stoic and a lot harder than I am, so they don't complain as much. I've had people walking on broken hips who've said it doesn't really hurt that much. Did you find her today?
I ring her twice a day to make sure she's okay. So when I couldn't get hold of her last night, I rang my daughter because I live at Bridlington, she lives in Wakefield.
Yeah.
So she nipped across, said she'd fallen.
We got her back in bed and she was sick. She thought it was best that she was looked at.
Yeah. Do you live on your own at home?
No, no, you do. She's almost.
Yes. Are you normally a bit mixed up and things, or is this a new thing with normal? And can I just have a little listen?
Dr. K examines Phyllis for any sign of injury from her fall.
And that's fine. And am I alright just have a quick feel of your tummy? Is that okay? Any pain anywhere in your tummy?
Oh no, I really don't.
No. Okay.
so don't press.
I won't, don't worry. And then I'm just going to have a little look at these legs of yours. Are you able to lift this right leg straight up in the air for me? Perfect. And what about this other leg? Perfect, that's fine, well done. And you didn't hit your head at all? No. Can't find any serious injuries where we'd want to do scans or x-rays or anything like that. We're just waiting on your blood test to come back, because sometimes if you've been on the floor for a long period of time, that can affect your kidney function, where we need to give you some fluids to rehydrate you. What we'll probably do is get our physios to see you and see how you are on your feet. We want to keep you at home, don't we? Because it sounds like you're nice and independent and want to stay at home.
Oh, definitely.
If you need anything, just give us a shout, okay? All right.
Dr. Kay has ruled out physical injuries, but Phyllis will need to pass the physiotherapist test before she can go home.
You're huffing and puffing a bit. Are you all right?
I'm always huffing and puffing. I'm in A&E.
What do you mean you're in A&E? You should be happy then. You're in the best place there is to be.
Barnsley Casualty is struggling with a record number of people, and Nurse Val has put aside her managerial duties
Knock, knock. Hello, is it Ian?
to ensure all patients get the attention they need. In cubicle 7, 92-year-old Phyllis has been brought in after having a fall. She lives alone and wants to go home. But Dr. Kay is worried that she isn't strong enough. She'll have to convince physios Liz Hughes and Alice Cusworth that it is safe to discharge her.
The doctor's quite happy that there's no medical reason to keep you here, which is good. But what we now need to do is see what you're like on your feet, if that's okay, and make sure that you're going to be okay going home. Are you okay to come and work your way so you're sitting on the edge of the trolley for us? Don't worry, we've got you. If you let go of that, you're not feeling dizzy or lightheaded? No. You feel up to having a little walk? Okay.
To be allowed home, Phyllis will need to show that she can cope on her own.
Nice and tall for me. That's it. We'll turn left in the lane for the toilet there. We started off really well, and then I'm not sure if we got tired, but we struggled to get into the toilet. So we sat down and then we've been sick again, and then we really struggled to get back up and into that chair. All right for this, but I'm afraid as it stands, I don't think we're very happy to let you go home from here. Okay? No, sorry, not from what we've just seen. You need a little bit more time, and I think our team need to do some more assessments. We're worried.
Okay, fine.
She
I'll give
started off really well and mobilised, and we got to the toilet and she froze and gradually got further and further forwards onto the frame.
Yeah.
Family have said this shaking isn't at all.
I've just checked her white cells, they're slightly high, so we'll get her urine off, and it could be she's got a bit of a tummy bug that's causing the vomiting, and give her a bit of fluids. No, that's all right, we tried, didn't we? Hello again, I've just been hearing the dramas. Have you been misbehaving? No. I just looked at your blood test. You're probably a little dehydrated on the kidney front. We'll pop some fluid up, get you rehydrated. Hopefully that will help give you a bit more strength as well. And I think we might just need a bit longer. So we'll get a bit of you on our medical ward. There are no beds at the moment, I'm afraid, as you might have guessed from outside. So we'll get you on as soon as possible, all right? Okay, but you might be with us for a little bit longer than we would like, unfortunately. Okay, but we'll get you sorted. Is that all right? Yeah. Okay.
Unfortunately, it's not long before a bed is found and Phyllis is taken to the ward.
Right.
She left the hospital 2 weeks later, and after spending 12 days in rehabilitation, she proved she was fit enough to head home. In Resus, Nurse Richard has been treating Keith, who has motor neuron disease and is struggling to breathe. He discusses Keith's condition with Registrar Dr. Richard Mellors.
It's just gone downhill quite rapidly, and the family are fully aware of the progression of the disease and everything. They would like him to die at home, ideally, and they don't want me to be aggressive with him at all. They want him to die in peace now.
Who's he got with him?
He's got his wife and daughter. Oh, this is another Richard. He's one of the senior doctors in the department today.
So, looking at his blood gas test, obviously, what we would do in this situation is give him the BiPAP that he has at home. The place is massive, and that might buy him some time.
How long are we talking?
If we don't put the BiPAP on now, he'll die within the next hour or two.
The BiPAP is a mask that will help to regulate Keith's breathing.
I think the best thing for us to do at the moment would probably be to start with BiPAP, try and get him a little bit better, and buy him some more time.
If you're talking hours, I'm not sure if it might be better just for him to stay in here. Didn't want to go to the next stage.
This is what we'll do then. This is what we'll do.
And not able to talk.
We'll get you in a comfortable room and we'll just let nature take its course.
Dad, we're going to take this off. We're going to put your like the one that you have at home on. Yeah?
So we'll put BiPAP on 15 to 5 just to buy him time for his family coming. I really do not want to prolong his time. Oh, could I get him back to Weem awake again? I don't know, but to what end? You do get used to seeing tragedy, unfortunately, and you have to keep going. You've got to remain focused, and I think you push that out, maybe bottle it up, I don't know, but it's difficult to express how you get through it.
Keith's son arrives, and the family move to a private room. Shortly afterwards, Keith passed away, surrounded by his family. It's 6:30 p.m. The waiting time is down, and finally the department is running efficiently.
We're not actually doing that bad, are we?
No, I don't feel really rushed either.
No,
I
it
feel
doesn't.
Like they smell nice.
Sure. I don't know what I've sprayed. I've sprayed something before I come out. I don't know what it is.
Nurse manager Val's work in the hub is done, so it's time to head back to her office.
You sometimes don't feel like you've given all the care that you need to, but I absolutely believe that you have made a difference to people, and that's what keeps me going.
Thank you for today. You've been excellent. Take care, and I'll see you soon. Bye.
Even after the hardest days, you can walk away feeling proud. I am. I'm very proud.
Next time on Casualty 24/7.
Hello, the Hawksworth residents, lady of the house speaking.
Ready, steady, go.
When was her last seizure?
2 weeks ago.
2 weeks ago.
Okay.
Just show me where it's hurting then. Yeah. Oh, poor you.
Ah, well done. You'd make a good nurse.
Keep going, Max. That's what we said. Keep going. That's the main thing.
And that's next Wednesday at 9 as brand new Casualty 24/7 continues. A mother and son duo make for a volatile experience for Alex tomorrow as she heads to the Grenfell Arms in Maidenhead as a new series of The Hotel Inspector continues. Next tonight, it takes more than one security guard to control an abusive patient as if life weren't tough enough in A&E After Dark.